Hi, my name is Dr. Vicki Bowden, and I am a member of the Iota Sigma chapter of Sigma Theta Tau. I'm here today to give this continuing education session on evidence-based practice. Now, my own experience is serving as a nurse scientist at Children's Hospital of Orange County for their Evidence-Based Practice Scholars Program, and I have years of experience teaching nursing research at Azusa Pacific University. From those experiences, I know that even if we've had this in school, we do need a bit of a refresher about how to complete the evidence-based practice process, how to write a good PICOT, what are some tips about literature reviews and things like that. So with that in mind, let's go ahead and see what our topics today are going to be. I have the slide presentation for you where we'll cover things such as what is evidence-based practice, how to ask a good PICOT question, how to search the literature. Again, I think that you probably know how to do that, but I'm hopefully going to give you a few tips to help you improve your skills, and how to appraise the literature. So what is evidence-based practice? Evidence-based practice is a problem-solving approach to clinical practice that integrates the use of three major components: best scientific evidence, your own clinical expertise and experiences, and the patient preferences and values. All of these combine to make up what we consider evidence-based practice. And I want to say too that evidence-based practice is not just a nursing concept. Rather, evidence-based practice is an approach that all healthcare professionals can be using and should be using in their daily practices. So you may have had some exposure to evidence-based practice when you were in nursing school, or if you're like me who took nursing school quite some time ago, all they taught was nursing research. Like I had to use and learn all the steps of how to conduct a research study. And so therefore I learned all the research concepts, etc. But it was really focused on, I had to learn how to conduct a research study. Well, now the AACN has developed the Essentials, which came out quite a few years ago. And the Essentials, the core competencies for professional nursing education, says especially for baccalaureate nurses, the emphasis or the concept that needs to be focused on is evidence-based practice. This matches the definition we just talked about. The delivery of optimal healthcare requires the integration of current evidence and clinical expertise with individual and family preferences. Evidence-based practice is a problem-solving approach to delivery of healthcare that integrates best evidence from studies and patient care data with its clinician expertise and patient values. So that's the concept they emphasize in the Essentials. And then there's a domain that specifically addresses this. It's called Scholarship for the Nursing Discipline. And it talks about the generation, synthesis, translation, application, and dissemination of nursing knowledge to improve healthcare and transform healthcare. Under that, I pulled out a few things that specifically speak to evidence-based practice. That this is for a baccalaureate prepared nurse, should be able to demonstrate application of certain different levels of evidence. They need to be able to evaluate research, which means, of course, they do need to understand the research process and the components of the research process, because you can't pick up a research article and understand it if you don't understand the components of the research process. You need to evaluate clinical practice to generate questions. We should all be asking questions all the time. How do I improve my clinical practice? We need to be able to evaluate the appropriateness and strength of the evidence, which we'll talk about in this class. And then how to use best evidence in practice to make changes and participate in the implementation of a practice change to improve nursing care, hopefully based on the best evidence that we found. Now, a lot of people ask, but wait a minute, this takes a lot of time. And does evidence-based practice really improve patient care? Well, we know that it takes about 15 years to put research practice in findings into practice. Now you'll notice this is from an article in 2021. That's because previously the number had been 20 years to put research findings into practice. So that time is shortened, and I'm sure it's a result of the fact that we're using EBP practices so much these days. In 2016, it was found that EBP reduces patient complications and decreases healthcare costs. Although what we know is the focus should not be on doing it just to decrease healthcare costs. We know that we can provide better patient care by using evidence-based practice, and sometimes that may not translate into decreasing costs. We do know a culture and environment that supports EBP will sustain high quality evidence-based patient care. They'll be providing great care. And a strong EBP culture, along with EBP mentors, results in higher job satisfaction and intent to stay. So they actually looked at nurses that were in environments in which evidence-based practice, as was implemented, was taught, was expected, and there were EBP mentors to help the nurses in these changes, and found that there was a higher level of job satisfaction in those environments. Isn't that great to know? So you want to be in an environment that promotes EBP. You'll be happier in your job. And then a scoping review of 636 EBP articles indicate that EBPs improve patient outcomes and yield a positive return on investment for hospitals and healthcare systems. And remember, from what I just said, the positive return on investment is not just in the patient care, but it's in the nurses who are happy and satisfied about being in that environment. So there's less job turnover. But what is driving your healthcare approaches at your institution? What is driving how people look at healthcare interventions? Is it we always do it this way? It's what I learned in school, or it's what I learned from my first preceptor, and so it's what I have to do? It's just, this is the way I'm comfortable doing it. Or I am sure you've heard this one. It's what Dr. So-and-so says we should do. You know, you have a patient come in who needs pin care, and one doctor says to do it this way, and another doctor says to do it that way, and neither may be based on the best evidence. It can be so confusing. Or sometimes people say, well, this is what administration wants us to do. And again, it may not be based on the best evidence. Or some people say, well, I just don't know how to read a research article. So, you know, I can't really do evidence-based processes because I don't even know how to read those articles. And besides that, those articles are really boring. So these can all be negative statements that impact our approach to evidence-based practice. But what we want to do is really change that and be that fish jumping out of that kind of negative water and into an exciting space of our own that says, you know what? Examining our traditions and practice, education, management policies are good things. And we also need to be at a place where we say that EBP change is good and I'm willing to make changes. And I want to strive to base healthcare practices on the best evidence available. Also, what we want to do is create a culture of inquiry at our institutions and have it be a place where people feel comfortable having this culture of inquiry. We want to act on the best evidence rather than waiting for the best evidence to emerge. If we wait for it to emerge, if we wait for 50 articles on that topic, oh, that's why it can take up to 15, 20 years to get research changes into practice. We need to look at the best evidence available and start making changes then. And of course, we need to create a culture of lifelong learning where nurses are seeking more education and skill building in evidence-based practices. But there can be some barriers to evidence-based practice. Let's start with the barriers that can arise from the nurse themselves. Again, we talked about tradition. Tradition, you know, just don't want to change. I like doing it that way. I don't want to make any changes. That can be a real barrier to making changes in your practice. Lack of confidence in EBP skills. Perhaps you didn't go to school at a time in which you learned about evidence-based practice, or it's been a while since you were engaged in evidence-based practice skills. And so people feel that lack of confidence and then are afraid to do some of the evidence-based practice processes that they may need to do to bring about change. We know that evidence-based practice processes take time, and you may not have time in your clinical practice, time to look up articles, time to meet with others and discuss those articles, time to implement a practice change. The best place for this then is if you're in your practice councils or if you have some kind of shared governance where time is allocated to those kind of activities. Perhaps this is a place where you can do some of that work. You may feel there's a lack of support from others to use evidence-based practice, from your colleagues, from your managers. Perhaps you just, again, remember that you have to read a whole bunch of research articles and you think, well, I don't know how to interpret the statistics or interpret the results. Perhaps there's a lack of incentives to use evidence-based practice at your institution. For instance, in a lot of facilities, use of evidence-based practice and conducting evidence-based practice projects is incorporated in the clinical ladder. Is this part of what is happening at your institution? If not, perhaps that change should be made. Or you may work in an environment that's just anti-research culture. And of course, there may be a hesitancy to challenge physician authority or opinion, because many of our evidence-based practice projects, although they may be nursing-oriented, they also involved working with other members of the healthcare team, physicians, social work, etc., and we may be hesitant to work with them or try to suggest a change in their practice. There can also be barriers to evidence-based practice in leadership. For instance, a lack of a shared EBP practice model. We're going to discuss some models today. You may not have the support of nurse experts, nurse scientists, master's prepared nurses, clinical nurse specialists who can help. And if not, leadership needs to consider putting some of those people in place to help support EBP. I mentioned that EBP is not part of the clinical ladder. Perhaps if leadership is getting frustrated that EBP is not taking place, they need to be sure this is part of the clinical ladder. Need to be sure that EBP is aligned with the organizational priorities and valued. As a leader, you need to not just state your support, but actively engage in supportive activities. You may be, as a leader, in a place where change is not embraced. This can be a barrier to EBP or an anti-research culture, or as mentioned, just a lack of resources in general about ways then that EBP needs to be supported. Lack of library resources, time for the nurse, etc. There are also barriers to EBP in the evidence itself. There might be a lack of relevant evidence. You'll find that as you start doing your literature search and think, well, I just really can't find a lot of strong articles. There may be conflicting research findings. For example, one of my favorite examples is gum chewing after surgery to regain gastric motility. And some of the early research, there was conflicting results about, well, did it really cut down in length of stay by chewing gum afterwards? Did it really enhance gastric mobility by decreasing the amount of time to the first bowel movement, first bowel sounds? And that information was conflicting. But over time, as more evidence has been gained and the quality of the research has improved, there's clearly enough evidence to show that chewing gum after surgery is a good thing to be able to do. And it's inexpensive. The quality of the evidence, and then I go on and talk about the multiple grading and leveling systems, which goes back to the quality of the evidence. Notice on the left-hand side, for example, here's one example of a leveling of evidence pyramid. This one's by Melnick and Fineout Overholt. And this is just one. There's so many out there, and it can be a little bit confusing. So what I suggest is that at your institution, you actually review the different leveling pyramids, the leveling steps, and select one that's going to be used by your institution, both in the research areas, in policy making areas, etc. Because then you're all speaking from a consistent place and understanding consistent way to evaluate the evidence. And of course, we know that the evidence itself can be complicated because of the delay from research to the actual implementation in practice. Somebody does research, it may be a couple years later before they even get that information published. So that certainly adds to the delay, plus then that translation into practice. Lastly, a barrier can be the patients themselves. Remember, they're part of the evidence-based practice process. And patient preferences may not be known. They may just not adhere to whatever recommended treatment that you have, even though it's based on best evidence. Or sometimes they're just unwilling to change because they've been doing it one way for so long. And even though we have compelling evidence that they need to change, they just really don't want to change from their known method of care. Now, there are different evidence-based practice models. I'm going to go through a few today, and what the point that I'm really trying to make here is to not have you certainly memorize any specific model or choose a specific model, but just to expose you to a few and show you what is similar about these models. That the evidence-based practice processes have similar steps to them. For instance, this is the Iowa model, and it is a very popular model used. And one of the first steps is to identify triggering issues. So it all begins with the clinical question. And the clinical question can arise from new data about patients. It may arise from a quality improvement issue. It just may arise from questions you have in your own mind, or perhaps regulatory changes. So then you find and state the obvious question or purpose. And if it's a priority, remember institutional priorities are important, then in this case, they help guide to think about forming a team, a multidisciplinary team, to address that question and start looking at the evidence. So this is the next big stage, is assembling, appraising, and synthesizing the evidence. So you have to do a systematic search, and then you have to weigh the quality and quantity and consistency. And if there is sufficient evidence, then you can go on and design, in this case, a pilot of the practice change. But if there isn't, then perhaps it should be turfed over, and there might be interest at your institution in conducting research in that area. But if the evidence-based practice was enough, there was enough evidence there, then you can design a practice change, evaluate that practice change, and then decide how to integrate it and change practice and make it a permanent change in the practice. So that's just one model. Another one, Johns Hopkins University, says the same thing. Well, you start at that point of inquiry. What is the things that are, you're questioning in practice? Develop that practice question. You look at the evidence, do a complete search of the evidence. Then how are you going to translate that into practice? That becomes best practice. You improve what you're doing in clinical practice, reflect on that, and start the process again. On the right-hand side here, you can see there's more detailed steps to this. But again, it begins with asking a practice question. Then going on to evaluate, that's appraising, summarizing, synthesizing the information, and determining if it's compelling, if it's good evidence, or if there's just insufficient to move on. Then think about how you want to translate that into practice. That could be a pilot project, or perhaps you're just ready for a policy change, and that can be implemented. And then, of course, you need to think about how you're going to disseminate the findings. This one by Melnick, Feinout, Overholt, just describes 7 steps of the evidence-based practice process. It begins with that spirit of inquiry. Then you take that inquiry and think about, okay, well, how do I need to convert that into a clinical question? The clinical question, which we're going to talk about, is what drives the search for evidence. You critically appraise the evidence. Then you think about how to integrate it into your own practice. And this is where, again, it's bringing into your clinical expertise, the patient preferences, and how to make that practice change. All clinical or evidence-based practice processes need to evaluate the outcomes of the practice change. And then, of course, disseminate the findings, not only at your institution, but in other places so that it can benefit other people. At the Children's Hospital of Orange County, this is the EBP model that we've adapted. It comes from Brown and Eckhoff, and it begins again. You'll see this. We're talking about the similar things that you've seen in the last 3 models. What is the problem, the catalyst? And then you describe the problem. Then you ask the focused research question, the PICOT question. Start looking for your evidence, appraising that evidence. Is it reliable, valid, consistent? Then once you've done that, think about, well, what practice change do I think needs to be made? And you start applying that to practice, thinking about your desired outcomes, how you would implement it, what changes need to be made. Again, in all EBP processes, you need to evaluate the outcomes of implementing that practice change, think about if there's more adoption that needs to be done, and disseminate into practice. So what I've shown you here is several examples of evidence-based practice models. And evidence-based practice models all fall under what I hope your institution has, which is this culture of inquiry. That there's hopefully research going on, you're thinking about evidence-based practice, but you're also looking at quality improvement, and you're also looking at innovation. And these all feed one another, right? You might do something in quality improvement and realize based on that, you need to think about some evidence-based practice projects, or quality improvement may lead to some research. Or you're doing some research and realize there's really good evidence to make changes in practice, which then an evidence-based practice project, once it's implemented and in place for a while, really needs a quality improvement evaluation. And innovation is always in there because it can trigger the other 3 to get started, the other 3 processes. So this is a culture of inquiry that we really want to see started. So where does it all begin? Well, it begins with the searchable questions. And where do these come from? Well, you have to think about what is it you're just curious about? What has interested you in your clinical practice? What have you said in your clinical practice? Why are we doing it this way? Now, the questions that you have are formulated to help you search for articles in the electronic database. That's the purpose of the question. The question, the PICOT question, is what drives the literature search. So you produce your keywords then from your question that will help you use in your search for the literature. And again, I want to emphasize the question is the basis for your strategy search. The question is not an implementation project. The question is what drives the literature search. So you need to remember that compelling practice concerns and inquiry have to be converted into questions that are specific and non-biased. So we'll talk about that a little bit more as we think about types of PICOT question and how to develop them. But non-biased is like you don't want to already have pre-made up how this should go, how music should impact pain management. Music will improve pain management. That's your opinion, and it's biased. So you want to create questions that are not opinionated and not biased. There are different types of PICOT questions, and I listed them here. And in the next slide, you're going to see I actually have a little worksheet that explains these more. There's intervention or therapy questions. There's issue questions, meaning questions, prognosis, diagnosis, and etiology questions. This template for asking PICOT questions, which is easy to find on the internet, talks about each of these types of interventions or each of these type of questions and provides a little template that you can use to help ask a PICOT question. So you just need to stick in the words, the P, the I, the C, the O, and the T. So let's go and remind ourselves. Again, you can find this little sheet on the internet. And the sheet talks about the intervention therapy, which is what do you need to know is the best approach to a situation. The issue, what you need to know, what is the best approach to a situation, meaning what you need to know about the experience, and etc. Choose what you're thinking about, which type of PICOT question does it best fit into. But what are those components of the PICOT question? The first is the P, the patient or the population, the age, the gender, ethnicity, patients with a specific disorder. Then intervention is what do you plan to do for the patient? Comparison, what is the alternative? Outcome, what outcomes do you seek? And the time, what is the time frame for the intervention? Let's go and look at these in a little bit more depth. So P, the population or the problem. And you might have a population and a problem, or you might have a problem but no exact population. So you want to be specific because, for instance, looking at, I'm going to keep using this example of music, using music therapy with infants may not be as effective as, and may have a different effect than using music therapy on the elderly. So you want to really qualify the age range of patients if that is important, or gender or ethnicity if those things are important, as are, if it's important, what kind of condition the patient has. But you might also say that you have a PICOT question related not to a patient population, but to a problem like infection control or staff retention or order sets or procedural practices. So you can have one or the other. The I refers to the intervention or issue of interest. There's lots of different interventions you can look at: medications, treatments, education, or again, it can be an issue of interest, such as your work environment. What are the best onboarding practices? What are the best preceptor practices, etc.? The C, PIC, is comparing to the intervention. It could be by comparing to another intervention. It could be by comparing to a placebo, or in many cases, there is no other intervention you want to compare to. You just want to find the best practices or therapy for a certain condition or a certain intervention. Or you could be, your comparison is just whatever is the practice you're doing at your current institution. The PICO is the outcome. What are the outcomes of interest? For instance, is this intervention going to prevent something, make a change in morbidity, make a change in perceptions, decrease costs, avoid or impact side effects in some way, have some cost effectiveness issues? Any of those can be outcomes. And the T, which is often left off of the PICOT, because you'll hear people talk about PICO because they don't put the time frame in, which is okay, is what is the time frame of you would want to see these outcomes occur? Within a year, a few weeks, during the period of hospitalization, during the time of specific treatment. Again, not all PICOTs will have a T on the end. So they may become PICOs, little mini PICOTs, not have the T part of that. So I have an example of a clinical inquiry that I wanted to share with you. And this is from one that one of our evidence-based scholars conducted. And we'll see how this example, again, remember you're starting by asking, what is the issue? So you start with a little background for yourself. So in this case, the hospital skin, wound, and ostomy care SWAT team is responsible for reviewing available wound care products and for maintaining a wound care formulary. SWAT has no set wound care algorithms or clinical practice guidelines that inform this formulary. Wound care products selection is based on individual team members' clinical experience and patient preferences. In general, SWAT members endeavor to avoid overlaps in product selection and to be fiscally responsible in choosing products that are responsible. So here's a clinician that said, you know what, I'm part of the SWAT team, and I look at all the products we're using, and it's not making any sense because we don't have any algorithms, we don't have any guidelines, so should there be some guidelines? This is the problem that is then going to lead to a PICOT. And in this case, as intervention therapy PICOT, and in this case, it was for pediatric patients. So the P became for pediatric patients. What are the best practices for selection and use of topical products? I love an intervention that is best practices because sometimes you don't want to compare a single intervention to another intervention, the I to the C. You're just looking for what are best practices out there. So having an intervention, the I being best practices for selection and use of topical products compared to current practice. And the O is optimizing non-viable tissue and debridement and wound healing. Notice it didn't say improving or there's no biased words there. Optimize is a good word. And it's for the T in this case was during the hospitalization because that's when it's going to take place. So the final question became, in pediatric patients, P, what are the best practices for selection and use of topical products? I, compared to current practice. C, to optimize non-viable tissue debridement, the outcome, and wound healing during hospitalization, the T. In this particular case, the goal of this EBP project was to review and appraise the literature on wound care products. Because remember, the question is driving the literature review, with a focus on products that assist with debridement of wounds for pediatric patients. The findings from the literature review were used to evaluate the SWAT's wound care practices and to review the current product formulary for any gaps in that. So here's some pearls of wisdom when trying to develop a PICOT, and I just want to remind you of these. The PICOT questions, you've heard me say this now a few times, are the basis for your search strategy. They are not your project. Like you say, I want to make this change. You know, your PICOT is not the change project. The PICOT is driving the literature you're looking at to look at what is the best evidence. PICOT questions are always written in past tense and use terms that will be in the literature. So as I said, I work at Chalk. And so what we say is we don't chalkize things, and you may have a special way at your institution that you tend to put things in your own little word sets at your institution that aren't good because that's not how you're going to find them in the literature. So you want to be sure to use terms that are commonly used in the literature. And I said you don't want to use directional terms like improve and decrease, etc. And make sure your population and the outcome must match. So the outcomes have to address the population that you're actually using. So for yourself, you might think about what might be your PICOT. What are you interested in? What patient population do you work with? And then what is something that, and it may be very specific, by the way. You may work with hematology patients or cardiology patients with a specific condition. Then you decide what is the intervention you're questioning. And perhaps, again, you're comparing it to current practice at your institution, just asking, is that the best practice? And what outcomes are you looking at and the timing? I do want to go back and say about your patient population. Once you start, remember this is driving your literature review, start doing your literature review, you may find that for that specific intervention, you don't really find it for your patient population. And you may need to expand your literature search and decide to incorporate other patient populations that seem to be similar to the one you're interested in order to find the literature that you wanted. If you need to know exactly how to write that PICOT question, be sure and use this template and just plug in the word sets that you're going to use. It'll be so easy for you. So then you have to think about, here's another example of a sample PICOT and the keyword search. That was the next thing we're going to talk about, how to do a literature search. So the problem is the school nurse has noticed a decrease in physical activity among students, and she's interested in implementing an after-school fitness program to encourage physical activity and improve their fitness gram testing scores. In this case, the population is elementary school children. The intervention would be after-school fitness programs compared to unstructured play during recess. And the outcome would be fitness gram testing, and it could just be scores on the fitness gram testing. So that's an example. And using this, I want to go back to that again for just a second and say, you see how these, the P, the I, the COT, become key words then that you can use in your Google Scholar search, or your however you're going to do your search. So one of the ways I do like to do a search is by using Google Scholar. You know, you can say, oh no, that doesn't seem scientific enough. But I'm going to show you how Google Scholar search as a way to do a search can be really helpful for you. And I'll show that to you in a minute. So Google Scholar search is one of the ways I like to do things. And I'm going to show you in a minute how to do that. And I'd like to do it by just pulling up this Google Scholar. I have Google Scholar already prompted here. And say, in Google Scholar, I wanted to look up something. And in this case, I want to look up aromatherapy for pain management. So I'm using specific words, and I'm specific intervention. And when I do that, let's talk about a few things on this Google search. Well, you can customize your range here. If you want a whole bunch of newer articles, say I just want to use them since 2020, because perhaps things have changed, I could click that, and I get a more custom range there. And, or if I wanted to come here, say I want to do it in the last 10 years, so the neat thing about this is it's looking at aromatherapy, and it's already showing me some things like a systematic review, which is the highest level of evidence you can use. There's a couple things I want to note about using Google Scholar. One, I can tell how many people have already used this article. It's been cited. This article has been cited by 323 other articles. That means it was probably a pretty good resource, right? I also want to note you can click on the word cite here, and your citation comes up. If you're using APA format or whatever, it comes up in the different formats, so you can just copy and paste that into your reference list. I love that feature. The other thing I love is that if it's marked over here a PDF or PDF, you can click right there and it will get you to the PDF of that particular article. It'll pull it up right for you. And we'll see here. Pulled up the article. Isn't that great? Such an easy way to find articles and information. Also want to remind you that when you're looking at like a systematic review, The good part about it is that you can find other articles from that systematic review. So that's just a really quick overview of how to look up some good articles just using Google Scholar. So you can look at this more fully, but it's keywords. You want to make sure you're using keywords. You can also do a Google Scholar search using the words, what are the best practices for aromatherapy? What are the clinical guidelines for aromatherapy? And those will help you in your search too. And then you can use the My Library feature to mark your articles and save them for yourself. There's also other really good search engines, things like PubMed, EBSCOhost, and then of course you can go to numerous professional organization websites and find out some of their best practice statements, their best practice guidelines, etc. Remember, best evidence is not just research articles, it's looking for practice guidelines out there from other places. Then, once you get that research article, you have to think to yourself, well, how do I read this article? What do I do with the information? And articles usually have 5 major components. The first is the first component you want to look at is identifying the conclusions. We're going to talk about this a little more in just a moment. But the introduction has the purpose, the theoretical framework, gaps in the literature, statements, the question, the hypothesis. The methods section talks about the subjects, the methods, the variables, how data was collected, the instruments, reliability and validity. Of course, the findings sections has all the results, data collection methods, what was statistically significant, and the last, implications for practice. But as you're looking for literature, you think to yourself, I don't want to spend all this time just reading these articles. How can I cruise through them and decide what is the most important? And that's where you can go to identifying the conclusions first. You want to stick to that section where you look at the title, you look at the abstract, and then go to the discussion section. Because the title itself should convey the essence of the study, including hopefully the design. The abstract provides a great summary of the background, the purpose usually, methods, results, conclusions. Although you have to remember, abstracts are limited by a word count. So it may not tell you everything you need, but it gives you a great summary. So you can tell, is this related to that PICOT question I was asking? And then go to the discussion section. It'll give you an interpretation of the results. It'll tell you whether the research findings are consistent with the research. It'll identify any limitations and describe implications for practice. So as you start gathering your articles, you gather them, you look at that title, you look at the abstract discussion, and then put it in your save pile if you think it's going to be important and good for your use. Because eventually then what you're going to start doing is gathering all this information and thinking about the analysis of all of that information as a collective whole. You spend a lot of time in the PICOT process just collecting the evidence, the best evidence. The best evidence may be research studies, it may be clinical guidelines. I hope it's also reaching out to other clinical institutions and finding out what others are doing and asking for their guidelines, their policies. Remember, clinical expertise is a part of the best evidence process. So you're looking at the literature. If you're lucky, if you've hit the jackpot, you'll find some systematic reviews. This is where somebody has already taken this topic and looked at all the articles available, research articles only, and said, what is the summary of those research articles, and provided a systematic review of a summary of those articles. Or the next level down, what we typically see in the levels of evidence, is randomized control trials. Randomized being, some people are randomized to the treatment group and some people don't receive the treatment. That's what it means by randomized controlled trials. Or there's controlled cohort studies, which can be descriptive studies, not descriptive, correlational studies. So they're very specific about who's enrolled in the study, who's getting an intervention, etc. Uncontrolled studies are more like descriptive studies, or where it's not controlled, who's getting what type of treatment. And then we have our last level, level 5, the case studies, case series. Notice qualitative studies there, just descriptive statistics, about the frequency of something. Those are low-level studies, but still a level 5. Quality improvement reports, expert opinion, which is what you get from reaching out to your colleagues, finding out across the country. Remember, we can have nuances of things based on where we are in the country. So you want to find out what other people are doing, and that's considered level 5 evidence and very important evidence. And then in some cases too, especially in systematic reviews, they will grade the quality of the evidence, or in practice guidelines, they will determine whether it was a high quality or very low quality. And this is the grading of the evidence is often based on the rigor of the research that was done, the number of subjects in the study, ability to replicate, etc. So all of this is part of that analysis part, the analysis part, or said faster, the analysis part of the evidence-based practice processes. And you want to learn how to then organize your data. And there's lots of ways you can do this, but this is one that I've seen and I like using. Making sure you're getting your citation first, and then writing what type of level of evidence that was. So when you get the citation, mark right away for yourself. Well, was that, depending on whatever evidence pyramid you're using, whatever level of evidence pyramid you're using, was that a level 1, 2, 3, or 4? Just mark it right there. And then what I suggest is filling in the purpose, sample, and setting, some of your variables, what are your key findings, and the strengths and limitations. Now, what I also tell people is when you're trying to do a table of evidence, trying to summarize this information, to take this information directly from the article. Cut and paste directly from the article and put this in here. And the reason why you want to do this, especially if you're working with a team, is because you're collecting all you may have divided up all your articles, and then you have a common database that you can all use. So there we've covered a lot of information. We talked about what is evidence-based practice. We've talked about what is the PICOT. We've talked about what is a literature review, what are some hints about what to do in a literature review. We've also talked about how to look at the evidence and level it, and then how to collect some of that data and put it in a table that could be useful to you. So what can you do as next steps? Well, you need to think about what are questions of interest to you and use that template to hopefully write a PICOT. But I also have a couple of other things you can think about doing, and I want to show you those. I wanted to say, create a PubMed account. So this is an account so that you can get some literature sent directly to your in-mail box. You go into PubMed, you tell them topics you're interested in, and you'll have articles sent to you in your inbox. And that's such a great delight. Another thing you can do is the Wiley Online Library. And I want to show you what that looks like really quick. So Wiley is a main producer of a lot of journals. And you can go onto the Wiley Online account, and it's a free account you set up for yourself. And when you do that, you choose which journals you would like to have weekly or bi-monthly or whatever frequency you want. And the journal table of contents will be sent to you. So my interest is in pediatrics, so I have several pediatric journals that I get the table of contents sent to me in my in-mail box. And what's so great about that is I can cruise all these journals and just say, hey, are there any articles there that are of interest to me and that I need to review just to help me out. So that's another thing you can do. Another is to also bookmark for yourself the Agency for Healthcare Research and Quality. And the reason I say that is because if you go into some of the tools, etc., and under some of the research, look at this, evidence-based practice reports, fact sheets, etc. So you can easily get reports of guidelines that are already out there on some of the topics you may be interested in. And then lastly, just because I'm an APA guru, I say go ahead in and on your computer, you should have Purdue OWL bookmark so you can easily see as you're getting your literature and writing down your references where they are. So I hope you have found this helpful today. Again, just a refresher course. There's so much more to cover in evidence-based practice. It's great fun to be involved in an EBP project and to have that thought of always being open to new inquiry, finding new ways I can increase my knowledge and improve my clinical practice. And I hope today I've given you a few skills to be able to do that. If you have any questions, please let us know and we'll get to those questions. Thank you for joining us today.